We live in a globalized world where everything is connected and diseases move faster across borders. In order to better protect their citizens, countries need to monitor the health of populations and also build capacity to identify and respond to risks emerging internationally that can affect them. Enhancing health security in the global and regional levels is a priority that needs to be addressed in a coordinated way. New challenges posed by global spread of diseases and other bio-threats motivated the adoption of the WHO International Health Regulations in 2005. A set of standards to ensure that countries act in a harmonized way to respond to health crises. To face this new context, the European Union decided to set up a regional initiative in its Mediterranean neighborhood to enhance the capacities in public health. Building on previous projects, the MediPIET program was launched in 2013 to transfer the experience of European training programs to the Mediterranean.
We suggested to set up a training program that was inspired by FIIAPP-ISCIII, which is the EU fellowship program. But it's important also that this is not a carbon copy of FIIAPP-ISCIII. This is its own program. It builds on a strong ownership of the countries, and it has a regional dimension, a regional profile.
18 countries of the Mediterranean, the Balkans and Black Sea are partners in MediPIET. Morocco, Algeria, Tunisia, Libya, Egypt, Palestine, Jordan, Lebanon, Bosnia and Herzegovina, Montenegro, Serbia, Albania, Kosovo, the former Yugoslav Republic of Macedonia, and since 2014, Ukraine, Moldova, Georgia and Armenia. In addition, Israel and Turkey are observers, and finally, Greece, France and Spain provide scientific advice and bring the EU perspective and expertise to the network. Altogether, they comprise a unique network of public health institutions, covering a shared European and Mediterranean space.
This project is special because it's covering several regions. So it's one project covering nearly 4 regions. We have the African Atlantic facade, the North Africa and Sahel, the Middle East and the Southeast Europe that is covered by the project. So you have a unique mosaic of countries, of people and culture.
The European Union established this network in the frame of the CBRN, Centers of Excellence Risk Mitigation Initiative, and the scientific leadership of the European Centre for Disease Prevention and Control. The implementation of MediPIET was entrusted to Instituto de Salud Carlos III, the public health institution of Spain, and FIIAPP, the Spanish International Cooperation Agency.
The program has been important for us for several reasons. First, the focus on Euro-Mediterranean space, which is a priority region for Spanish external action. And finally, because addressing global challenges such as CBRN threats is an important line of action for us.
The Mediterranean and the Black Sea region are particularly exposed to health risks such as epidemics, humanitarian crises, and natural or man-made disasters, which can have a serious impact on populations. MediPIET was established as a capacity-building training program for public health professionals to contribute to increase the region's preparedness and work towards a coordinated and harmonized response to health crises.
This network is very important in order to revitalize and to strengthen our capacities and also the international linkage. Because what was missing, at least for Albania in our institution, was this international dimension. And the network in this framework is the best venue to reinforce and strengthen our partnership.
The best way to train professionals and be prepared is through a field epidemiology training program at regional level.
MediPIET is an FITP, that means it is a field epidemiology training program. It's a program that is not at the university, but it is in-job training. People are trained when they are doing their daily job.
What are the elements of an FIIAPP? First, it consists of theoretical training modules for public health professionals. It is also a network of training centres, which are the national institutions responsible for surveillance and training in epidemiology. Some of these training centres host fellows who are the junior professionals following the 2-year learning by doing training and closely monitored by national supervisors. A training centre that hosts fellows and supervisors is known as MediPIET Training Site. At regional level, fellows are mentored by the scientific coordinators of the programme. The MediPIET scientific coordinators are the overall coordinators of the training programme, primarily monitoring the fellows, but also conducting the theoretical training modules.
The main role of the scientific coordinator is to ensure the scientific quality of the training program.
The modules are attended by participants from all the countries, fellows from the training sites, for whom all theoretical modules are mandatory, and professionals from training centres, known as external participants. External participants come from different national institutions and health services and are selected on a case-by-case basis depending on the theme of each module.
It's very important, first of all, for our young, new generation of epidemiologists to create this networking between Black Sea and the Mediterranean countries with our European Union colleagues.
The theoretical modules cover the core competencies needed in field epidemiology, such as methodology for outbreak investigation, surveillance, food and waterborne diseases, and other diseases transmitted by vectors, or the health response to humanitarian crises, and chemical, biological and radionuclear threats, among others.
We participate in many modules and our different modules before that with MediPIET that talking about outbreak investigation and other aspects.
I'm coming from Montenegro. For us, this training is really very important since Montenegro is in process of preparation to join EU, and we would really like to follow all this procedure to standardize our approach for surveillance, outbreak investigation, and it's very important for our capacity building.
It's very important for our country to enhancing capacity, enhancing system in order to have his health security.
Hopefully will be very helpful for the country once we have some countries that solidarity, that your region, that they are helping you with technical support, with information, with capacity building. For Libya in particular, this is very important project and collaboration and networking program.
Besides the theoretical courses, fellows have to complete practical assignments as part of their in-job training. These assignments include the evaluation of surveillance systems, outbreak investigation, and study protocols.
So we are visiting a primary healthcare center, which is in charge of treatment and screening for hypertension and diabetes. We are going to evaluate the quality of care, screening, the diagnosis.
Here at the observatory, when we are working with the population, we are working with this first line. That's why all our field activity are related to this center of primary health care. When we have any outbreak or any signal about any disease, there is a team who is in charge to supervise and to investigate the outbreak, and the fellows are part of this team. We can go to the population and to ask them directly.
Another important element of the fellows' practical training are their international assignments. A working visit in a public health institution abroad to learn new techniques, new skills, new methods that they can later apply in their country.
Experience gained through that field visit is definitely going to help me to improve procedures in my home country.
What we provide on any fellowship opportunity for the fellows or for resident doctors or health professionals we have here, this is also a training center for that, showing sources of information, showing how we deal with information and how we interpret the public health impact it may have, in this case, at national level.
we saw much more than epidemic intelligence. We saw also and preparedness. We saw how the system functioned. A lot of procedures. We also met people on a local level. We met people that are key partners from them. So I'm really happy.
My second international assignment that I have done in Rome, in the Istituto Superiore di Sanità, worked about the case definition of aseptic meningitis. It was very useful, and this has helped me to improve my surveillance system, but not only in this disease, but also in viral hepatitis.
Part of my job at the Ministry of Health at the surveillance of influenza was also to take part with the WHO team that was assessing the influenza surveillance in Morocco. And this was covered as my MediPIET international assignment.
It's very interesting when you see different types of surveillance systems, and you know how you can understand how to improve your system and or how to change something in your system or in other system. It's very good. I like this international assignment.
It is an opportunity not only to gain from the expertise of others, but to build strong professional relationship bonds between apparently unrelated individuals and unrelated institutions and unrelated countries.
Every year, MediPIET celebrates a scientific conference where professionals from the region present their research projects, outbreak investigations, or evaluation of surveillance systems.
This conference is very important, especially for fellows. It is very good experience for fellows. It is one of the best part of the project.
The MediPIET conference is a unique space of scientific collaboration in the region.
The same fellows of the first annual scientific conference with this one, they are completely different persons.
During the 5 years of MediPIET, the European Union and the Mediterranean countries have successfully built a network of well-prepared field epidemiologists that can work together and be rapidly mobilized.
We have implemented new surveillance system for influenza, and now we are in the process of implementing vector-borne disease surveillance integrated between vectors like mosquitoes and human cases. All of these things were not part of our surveillance before the MediPIET.
Still, the region is not fully equipped to respond to unexpected health threats. The Euro-Mediterranean cooperation in health security established in MediPIET needs to be consolidated in a sustainable way to ensure that we continue working together for the benefit of our populations.
International alliances in public health highly strengthened health security at regional but also at country levels.
Now we need to consolidate that experience and build a common and sustainable future. To that end, my institute, Instituto de Salud Carlos III, is strongly committed to conduct that project from 2018.
The MediPIET network is a useful tool to protect our citizens in these biothreats, but also to promote the social cohesion and the welfare of the population.
Working together for better health protection.